Two military police officers walked into Hargrove Memorial Hospital on a Tuesday morning and told everyone within earshot that the quiet nurse in Bay 4 had been stealing drugs. They said it loud. They said it with badges out. Nurse Emily Voss stood at the medication cabinet with her hands shaking, not from guilt, but from the nerve damage that had lived in her left leg for 6 years, and she watched every colleague she'd trusted turn to look at her like she was someone they'd never actually known. The charge nurse covered her mouth, the attending physician took a slow step backward, and Deputy Marcus Holt looked at Emily's trembling hands and said, "That's what guilt looks like." He was wrong, but no one in that hallway said so. Before we go further, if this story already has your pulse running, you're exactly where you're supposed to be. Hit that subscribe button right now so you don't miss what's coming in the next parts, because this one goes places that will leave you speechless. Drop a like and tell me in the comments what city and country you're watching from. I want to see how far this story travels. Now let's get back to Emily. The morning had started the way most of Emily's mornings started at Hargrove Memorial, badly and early. She'd clocked in at 5:47 a.m., 13 minutes before her shift technically began, because the overnight nurse on trauma had paged her twice about a patient in Bay 6 whose pressure was dropping and whose chart hadn't been updated since midnight. Emily had driven through the last of a March snowstorm to get there, parked in the lot furthest from the entrance because she always did, and walked the distance with her left leg dragging slightly more than usual in the cold. The brace she wore, black carbon fiber, custom fitted, running from just below her knee to mid-shin, was designed to compensate for what the nerve damage had taken. In warm weather, it did its job. In cold, everything tightened, and the walk from the parking lot to the ER entrance felt longer than it was. She didn't complain. She never did. That was the problem, some people said, that Emily Voss moved through the world like someone who had long ago decided that explaining herself was a waste of time she didn't have. Hargrove Memorial sat on the eastern edge of Dunmore, Colorado, a mid-sized city that existed somewhere between the kind of place people moved to on purpose and the kind they ended up in after something went wrong elsewhere. The hospital served a patchwork of communities, farming families, veterans from the base 20 miles north, seasonal workers, retirees who'd come for the elevation and stayed for the cost of living. The ER was chronically understaffed, perpetually running on half a pharmacy budget, and held together largely by people like Emily, who showed up before they were called and left after everyone else had gone home. She had worked there for 4 years. She had filed 11 internal incident reports in that time, 6 about medication tracking software that occasionally duplicated transaction records, creating phantom entries that made it look like narcotics had been dispensed twice when they'd only been dispensed once. She had flagged it to her charge nurse, Renata Diaz. She had flagged it to the pharmacy liaison. She had put it in writing 3 separate times to the hospital administrator, a man named Gerald Fitch, who had responded to her last memo with a single line. "The software has been reviewed and cleared by IT. Please focus on patient care." That memo sat in Emily's email inbox, time-stamped 9 weeks ago. She thought about it sometimes when she passed the medication cabinet in Bay 4, the one with the digital lock and the dispensing log that had been quietly generating errors since before she'd even started raising the alarm. She was thinking about it on Tuesday morning when she heard the automatic doors from the ambulance bay slide open, and 2 people walked through who weren't paramedics and weren't patients. They wore civilian clothes but moved like people accustomed to not being questioned. One of them, Deputy Marcus Holt from the Dunmore County Sheriff's Office, was mid-40s, thick through the shoulders, and had the particular kind of jaw that people in authority sometimes develop when they've spent too long in rooms where no one argues with them. The other was a hospital compliance officer named Sandra Veen, a woman Emily had seen twice before at mandatory training sessions and never spoken to directly. Renata met them at the nurses' station. Emily watched from across the hallway, one hand still resting on the frame of Bay 6's door, as Renata's expression shifted from confusion to something more careful. "Is there a problem?" Renata asked. "We need to speak with Emily Voss," Holt said. He didn't lower his voice. The hallway wasn't empty. It was never empty at 6 in the morning in a working ER. There was a transporter pushing a wheelchair. There were 2 nurses from the night shift finishing their handoff notes. There was a family in the waiting room visible through the glass partition. And there was Dr. Kelsey Ahrens, the attending who'd been on since midnight, standing at the end of the corridor with a tablet in her hand and absolutely no expression on her face. Emily stepped out of Bay 6's doorway. "That's me." Holt turned toward her. He looked at her the way people sometimes did when they were expecting someone different. Bigger, maybe, or angrier, or more obviously guilty of something. What he saw was a woman in her late 30s with dark circles under her eyes, a brace on her left leg, and the flat, watchful stillness of someone who had learned a long time ago not to react visibly to being assessed. "We've had a report," he said. "The controlled medications have been going missing from Bay 4. The dispensing logs show repeated anomalies over the past several weeks. Your access code is attached to a significant portion of those transactions." The hallway went very quiet. Emily said, "I know about the anomalies. I've been reporting them for months. There's a duplication error in the dispensing software." "We'll need you to open the cabinet," Sandra Veen said. Her tone was the practiced neutral of someone who'd delivered bad news many times and had trained herself not to feel it. "Okay," Emily said. She walked to Bay 4. Her leg dragged more than she wanted it to in the cold, and she could feel the deputy watching the irregularity of her gait. She unlocked the medication cabinet with her code, opened it, stood back. The cabinet held exactly what it should have held. The physical count matched the on-hand record. Any missing quantities existed only in the software log, in the ghost entries that had been generated and ignored and generated again for the better part of 6 months. "Your hands are shaking," Holt said. "Yes," Emily said. "That's a nervous reaction." "No," Emily said. "It's nerve damage. My leg stops cooperating in cold weather, and so does my left hand sometimes. I have documentation if you'd like to see it." He didn't ask to see it. What he did next was worse. He turned to Renata Diaz and said, in a voice that carried exactly as far as he intended it to, "We're going to need her pulled from patient contact while we complete our review. Is there somewhere she can wait?" Renata looked at Emily. Emily watched her charge nurse decide, in real time, to take the path that caused the least friction with the people holding the badges. It wasn't cruelty. Renata was tired and the hospital was already short-staffed, and she had 11 other things demanding her attention. But the decision landed the way it landed. "Family waiting room off the East Hall," Renata said quietly. "It's empty right now." Emily picked up her bag from the nurse's station. She didn't say anything. She walked to the East Hall waiting room, a beige box of a room with plastic chairs and a table with magazines from the previous year, and she sat down and she waited. The waiting room had a window that looked out onto the hospital's east parking lot, and beyond that a stretch of Colorado plains still half buried in snow. Emily had been in the room for 40 minutes when Dr. Ahrens appeared in the doorway, looked at her, and said, "For what it's worth, this is absurd." "I know," Emily said. "You've been filing those software reports since before I got here." "I know." Kelsey Ahrens leaned against the door frame. She was in her mid-40s, small and precise, the kind of physician who remembered every patient detail without writing it down, and who ran a trauma bay with the quiet authority of someone who had long since stopped needing to raise her voice. She'd worked with Emily for 2 years. She trusted Emily's clinical instincts more than she trusted the judgment of most of the attending physicians in the building, though she'd never said that out loud where it could be used against her. "Fitch is in the conference room with them now," Kelsey said. "Of course he is. He's going to recommend putting you on administrative leave." Emily looked at the window. A crow had landed on the light post at the edge of the parking lot. It sat there in the snow without moving, which was something Emily understood on a level she couldn't have articulated. "He ignored every report I filed," Emily said. 11 months of documentation." "I know." "If he puts me on leave, those patients in Bay 6, I know Emily. She's been decompensating since midnight. Someone needs to—" "I've got her," Kelsey said. "I'm handling it." She paused. "I just wanted you to know that not everyone in this building thinks you're guilty of something." Emily nodded once. Kelsey left. The crow on the light post outside didn't move. Gerald Fitch found her in the waiting room 22 minutes later. He was the kind of hospital administrator who wore his position in his posture, back straight, chin level, the faint performance of someone who had learned to confuse authority with competence. He was 61 years old and had run Hargrove Memorial for 9 years without ever having worked a clinical floor. "Emily," he said, closing the door behind him. He sat across from her without asking. "Mr. Fitch." "This is a difficult situation," he said, with the particular tone of someone for whom the situation was not actually difficult at all. "You ignored my reports," Emily said. She didn't inflect it. She stated it the way she stated clinical findings, as data, not accusation. Fitch cleared his throat. The software was reviewed by IT. The software was looked at by IT. That's different. They ran a surface check and cleared it because the error only appears under specific dispensing conditions that don't show up in standard diagnostic scans. She had explained this in her third written report. She had included the specific conditions. "I sent you the documentation." "The investigation is ongoing," Fitch said. "Am I on leave?" A pause. "We're suspending your access while—" "Am I on leave?" she said again. "It's a precautionary measure." Emily stood up. Her leg resisted the cold in the way it always did, and she steadied herself against the chair back for a moment before straightening fully. She was taller than Fitch when she stood. He noticed that, and recalibrated. "My access badge," she said, and held it out. He took it. She picked up her bag. "I'll want that back," she said, and walked to the door. She was almost through it when she heard Holt's voice from somewhere down the east corridor, too loud, the way he'd been too loud all morning, saying something to another officer that included the phrase voluntary cooperation and the phrase, "or we take the next step." Emily didn't stop walking. She went through the east exit, down the side stairwell, and out through the lower lobby, because she knew exactly which exit would put her farthest from anyone who was waiting to watch her leave. The cold outside hit like a wall. Her leg tightened immediately, and she had to slow her pace to compensate. She made it to her car, sat in the driver's seat, and put both hands flat on the steering wheel. She did not cry. She had not cried in a long time, not since a night 6 years ago in a field hospital, in a place she didn't talk about anymore, when the explosions had stopped long enough for her to look down and realize what had happened to her leg, and she had understood with a strange clinical detachment that her life had just divided itself in two, before and after. She had not cried then either. She had waited for the medic to finish his work, and then she had helped him bandage the soldier in the next cot, because there was someone who needed it. She sat in her car for 9 minutes. Then she turned the ignition. She had made it as far as the parking lot exit when her phone buzzed. Unknown number, but a Dunmore prefix. She almost didn't answer it. She answered it. "Ms. Voss," a man's voice, low, measured, with the flat precision of someone trained to remove inflection from their speech when the situation was serious. "My name is Captain Daniel Reyes. I'm calling from the 114th Integrated Support Command, based north of Dunmore. I apologize for the timing. We have an emergency." Emily kept her hands on the wheel. "What kind of emergency?" "We have a military working dog with a blast injury being transported to your facility. He went into respiratory distress 4 minutes ago." The veterinary team requested a trauma-trained civilian nurse on standby because our MWD specialist is currently deployed and the animal is— A pause, precise and brief. "He's not responding to our personnel. He keeps pulling toward the exit." "I'm not on staff right now," Emily said. Her voice didn't change. "I know," Captain Reyes said. "I know exactly why. That's why I'm calling you directly." Another pause. "Ms. Voss, your record was flagged when we called in the request. The animal's designation is K97. He served 3 tours in a classified theater of operations. His last combat handler on record is listed under a service file that's been partially redacted." A beat of silence. "But the primary medical contact listed in the emergency protocol is you." Emily's hands tightened on the wheel. "His name is Ranger," she said. The voice on the other end of the line went quiet for a moment. When it came back, there was something different in it. Not warmth exactly, but recognition. "Yes," Captain Reyes said. "His name is Ranger." Emily turned the car around. She drove back into the Hargrove Memorial parking lot at 7:23 a.m., with no badge, no access, and no particular plan beyond the fact that a dog named Ranger was dying. And she was the only person in Dunmore, Colorado, who knew exactly how he breathed when he was scared. The ambulance was already there. She could see it from the lot entrance, backed up to the bay doors, rear panels open, 2 military personnel in civilian-adjacent gear, standing beside it, looking the particular kind of helpless that trained people look when their training doesn't apply. One of them had his hand extended toward the interior of the vehicle and was speaking in a low, steady voice to something inside that was not responding. Emily parked and got out. Her leg was still cold tight from the walk earlier, and the brace clicked once against the asphalt as she crossed toward the bay. A security guard she recognized, older man, name tag read Burtis, stepped out from the entrance and held up one hand. "Ms. Voss, I was told you're not—" "There's a K9 in respiratory distress," Emily said, not stopping. "I was called by Captain Reyes of the 114th. If you want to reach him to confirm, his number is in your system because he called the hospital 14 minutes ago." Burtis hesitated. She walked past him. The man standing at the rear of the ambulance turned as she approached. Mid-30s, military bearing even out of uniform, the kind of tan that came from sustained outdoor exposure rather than leisure. His name tape on the tactical vest read SGT, Callum Price, and he looked at Emily with the specific expression of a person who has been told help is coming and isn't sure if this is it. "You're Voss?" "Yes." He stepped back from the ambulance without another word, which told her more about the situation than any briefing could. She pulled herself up into the rear of the vehicle and her eyes adjusted to the dim interior in under a second. Ranger was a Belgian Malinois, 80-some pounds, dark muzzle shading into the deep tan of his coat. I was lying on his side on the transport pad with an oxygen mask held loosely near his face by a third military handler who looked about 22 and was trying very hard not to show that his hands were trembling. The dog's chest was moving, short, labored rises that weren't pulling enough air. His eyes were open and tracking, which was something. His head was up, barely, and his gaze moved around the space in the fragmented way of an animal that was trying to locate something it needed and couldn't find. Until it found Emily. The change was immediate and strange. Ranger's head came up a full inch. His ears, one of which had a notch in it from what looked like an old wound, rotated forward. The labored breathing didn't stop, but the frantic quality of it shifted into something that was still frightened but no longer panicked. He made a sound low in his chest that wasn't quite a whine and wasn't quite a bark. "Easy," Emily said quietly. "Easy, buddy. I've got you." She moved to his side, went down on one knee despite what it cost her leg to do it, and put one hand flat on his rib cage. She could feel the mechanical dysfunction in the way his chest moved. Left side expanding less than the right, a pattern she recognized from a different context in a different country, a long time ago. "What happened?" she said to the young handler without looking up. "He was running a search pattern in a training exercise at the North Range, and we don't know exactly. The MWD coordinator thinks he hit something. There was debris from a controlled demolition from last week, and they hadn't fully cleared the perimeter. He went down fast." "Any penetrating wounds?" "No visible. There's bruising on the left flank." Emily ran her hands carefully along Ranger's left side. The dog held still under her hands with a patience that would have seemed unnatural if she hadn't known him well enough to understand that stillness was how he communicated trust. Her fingers found the swelling below his ribs, not massive, but present and tender enough that even a sedated animal would have flinched. Ranger didn't flinch. He watched her face. "Pulmonary contusion," she said. "Possibly a small pneumothorax developing on the left. He needs imaging, and he needs it now." She looked at the young handler. "Does Dr. Farrow know he's here?" "Who?" "Veterinary attending. She works with military animals. She should be paged." "We tried the main desk and they said, page her directly. Her extension is 3147. Emily looked at him until he reached for his radio. Then she looked back at Ranger, who had not stopped watching her, and said again quietly, "You're okay. You hear me? You're not done yet." What happened next in the ambulance bay happened in front of witnesses, and that mattered, though no one realized it yet. Sergeant Price helped Emily get Ranger onto a transport gurney, which required coordinating 3 people and the specific knowledge that Ranger would accept handling from his left side but not his right, a quirk from an old injury that Emily knew and Price didn't, and which she communicated in 4 words, approach from his left, that made the difference between the dog cooperating and the dog fighting them. They moved fast. Emily kept one hand on Ranger's flank the entire way through the ambulance bay doors and into the lower corridor, and Ranger kept his eyes on her face, and the young handler followed behind them with the portable oxygen unit, and Burtis the security guard stood to the side and did not try to stop her again. Renata Diaz was at the nurse's station when Emily came through. Her face went through 3 expressions in roughly 1 second: surprise, something complicated, and then a rapid professional recalibration. Emily, you don't have... I know. I'm here for the K9. Dr. Farrow is being paged. I need Bay 3 cleared and I need a portable ultrasound. She kept moving. I'm not accessing the medication cabinet. I'm not touching a controlled substance. This is a veterinary emergency, and I'm the person Captain Reyes called. Renata opened her mouth and closed it. Then she picked up her radio and said, Bay 3, clear it. Emily didn't stop to thank her. She didn't have time. But Dr. Mara Farrow arrived in Bay 3 11 minutes later, which was fast enough that Emily suspected she'd already been in the building. She was a compact woman in her early 50s with short silver hair and the particular competence of someone who had spent decades working at the intersection of military medicine and veterinary trauma. She looked at the situation, Emily, the dog, the military personnel arranged around the bay, and said, "What are we working with?" Emily gave her the rundown in 45 seconds. Farrow listened without interrupting, then moved to Ranger's side and began her own assessment with the systematic thoroughness of a clinician who trusted the information she'd been given but verified anyway. After 2 minutes, she straightened and said, "Good call on the pneumothorax. Minor, but it's there. We're going to need to watch him." Chest tube? Not yet. We'll see if it resolves. His oxygen saturation is coming up. Farrow looked at Emily over the dog. You did well getting him stable. He did the work, Emily said. Farrow almost smiled. Then she looked at Sergeant Price and said, I'll need your team out of the bay. He's stable enough for now, and he does better with fewer people. Price looked at Emily. She stays? Farrow said without hesitation. She stays. Price nodded and moved his team into the corridor. Farrow waited until the bay curtain closed and then said, without looking up from the chart she was starting, I heard what happened this morning. News travels. Fitch put you on leave? Suspended my access. Farrow made a sound that wasn't quite a word. The software problem in the dispensing system has been documented in 3 other departments. Did you know that? Emily looked at her. No. Pharmacy flagged it 6 weeks ago. Fitch told them it was a user error. 2 weeks ago, radiology had a phantom narcotics entry that their department head traced back to the same system bug. Farrow finally looked up. You weren't the only one. You were just the loudest. The word loudest sat strangely in the air between them, because everyone in the hospital would have described Emily Voss as anything but loud. But Farrow meant it as something else, not volume, but persistence. 11 reports, 11 times committing the inconvenient fact to paper. Who else knows this? Emily asked. Right now? Me, the pharmacy lead, the radiology head, and apparently the 114th Support Command, because Captain Reyes made some calls this morning after he got off the phone with you. Farrow set down the chart. I think you should know that he didn't call you randomly, Emily. He pulled your service file. The bay went quiet except for Ranger's steadier breathing. That file is partially redacted, Emily said. Partially, Farrow agreed. The part that isn't redacted includes your field medical record and your emergency protocol designations, and Ranger's file, which lists your name as his primary medical contact because apparently you put it there yourself before you separated from service. Emily looked at the dog. Ranger had his head down now, eyes half closed, his breathing settling into something approaching normal. The oxygen mask was off. He looked, in this moment, like a large dog sleeping in an inconvenient location, which was almost enough to make her smile. I put it there so someone would call me if he ever got hurt, she said. I didn't think anyone would actually do it. Reyes did. I noticed. Captain Daniel Reyes arrived at Hargrove Memorial at 8:51 a.m. and walked through the front entrance in a way that made the lobby staff step back without quite knowing why. He was not physically imposing, medium height, lean, early 40s, dressed in service uniform rather than combat gear, but he had the kind of forward-directed attention that people with operational backgrounds sometimes carry like a second body, invisible and unmistakable. He asked the reception desk for Emily Voss, was told she didn't currently have facility access, and said, I know, tell me where she is anyway. They told him. He found Emily in the corridor outside Bay 3, leaning against the wall with her arms crossed and her brace visible below the hem of her scrub pants. She'd borrowed the scrubs from the staff locker room because someone had gone to get them for her without being asked, which surprised her more than it probably should have. She was looking at nothing in particular when Reyes came around the corner and stopped 2 feet away. He looked at her for a moment. Then he said, "You look exactly like your service photo." "That photo is 11 years old. You look tired in both of them." It was not the kind of thing she expected a captain to say. She straightened slightly against the wall. "How's the 114th? "Functional." He glanced at the bay curtain. "He's better?" "Farrow thinks the pneumothorax will resolve without intervention. She wants to monitor him for 6 hours. Emily paused. "You pulled my file." "I did." "That file has a clearance designation on it." "I have the clearance." He said it without emphasis, which meant it was probably an understatement. "I've been briefed on Operation Meridian Cross." The name landed like something physical. Emily didn't move, but something changed in the quality of her stillness. Operation Meridian Cross was a humanitarian mission that had run for 8 months in a region. The official record described as a stabilization theater, which was the kind of language that military documentation used when the truth was too complicated to be useful. Emily had been attached to a forward medical unit for the last 4 months of it. She had been, on paper, a trauma nurse assigned to non-combatant support operations. What that had meant in practice was a field hospital that took fire twice, a rescue extraction that she had participated in when the extraction team was 2 people short, and a night in month 6 when a vehicle-mounted explosive device had gone off 30 meters from the hospital tent, and she had kept working for 4 hours before anyone noticed that a fragment had gone through her lower leg. She had received a commendation for that night. It was classified. She had received a medical retirement 6 months later. That was not classified, but she didn't talk about it. "Why does that matter now?" Emily asked. "Because Deputy Holt filed a preliminary criminal referral this morning," Reyes said. "Not just administrative leave, an actual referral to the county DA's office." The corridor was cold and fluorescent lit and smelled like antiseptic and coffee from the nurse's station 40 feet away. Emily looked at the middle distance for 3 seconds. Then she said, "On what basis?" "The dispensing log anomalies. He's arguing that the volume and pattern suggest deliberate falsification rather than software error. The software error has been documented in 3 departments. He doesn't know that yet." Reyes watched her. "Fitch hasn't shared that information with the investigators. I'm told his compliance officer is also unaware." Emily absorbed this. The shape of it became clear in a way that made something harden quietly in her chest. Not rage exactly, but the particular cold clarity of a person who has been patient for a very long time and has just identified the precise nature of the wall in front of them. "He knew," she said. "Fitch?" "He knew the software problem extended to other departments. He had to have known. He runs the facility reports." She looked at Reyes. "He let the investigation move forward knowing that the evidence was contaminated." Reyes said nothing, which was its own kind of answer. "He didn't just ignore my reports," Emily said. "He buried the corroborating data." "That's a significant allegation." "I know what it is." He studied her for a moment. He had the eyes of someone who assessed situations for a living and had learned to be accurate about it. "There are people at the 114th who want to make a statement in support of your character. There are also people who've reviewed your service record and believe that what happened to your career, the way it ended, the things that weren't put in writing correctly, was handled badly." "It was a long time ago." "That doesn't mean it was handled correctly." Emily looked at him. She had spent 6 years not expecting anyone to say that. It landed somewhere uncomfortable, in the part of her that she'd sealed off, not because she wasn't still hurt by it, but because being hurt by something you couldn't change was a luxury she'd decided she couldn't afford. "What are you offering?" she said. "Right now, Ranger needed care and you provided it. That's what's happening today." He paused. "What happens tomorrow depends on what the hospital's IT team finds when they're asked the right questions by the right people." "And who's going to ask them?" "I made some calls this morning," Reyes said, "before I drove over here. The kind of calls that tend to make institutional systems suddenly very interested in being transparent." Emily looked at him for a long moment. "You move fast." "Ranger's been in my unit for 3 years," he said. "When I pulled his emergency protocol and saw your name, I pulled your file because I wanted to know who I was calling, and then I read what I read, and I started making calls." He said it without drama, which made it land harder than drama would have. "You kept working for 4 hours with a fragment in your leg, Voss. You're allowed to let someone make a phone call on your behalf." She didn't answer that. She looked at the bay curtain. I should check on him, she said. Go ahead, Reyes said. I'm not leaving. The next 3 hours had the quality of a held breath. Ranger's oxygen saturation climbed steadily toward normal under Pharaoh's monitoring. The military handler, whose name, Emily learned, was Specialist Yara Diekman, 23 years old and 6 months into her MWD handler assignment, sat in the corridor outside Bay 3 and drank bad hospital coffee and answered Emily's questions about Ranger's training protocols with the earnest precision of someone who was still learning her job but taking it seriously. Emily appreciated the earnestness. She'd worked alongside enough people who performed competence rather than developing it. Inside the bay, between checks on Ranger's vitals, she sat and thought. The shape of what Fitch had done was becoming clearer the longer she sat with it. He hadn't set out to frame her specifically. She wasn't important enough for a targeted campaign. What he'd done was simpler and uglier. When the software problem had become a liability and outside investigators had been called in, the path of least resistance was to locate an existing anomaly pattern attached to a single access code and allow the narrative to form around it. Emily's name was on the most reports. Emily's code was attached to the most flagged transactions, because Emily worked more bays and more shifts than almost anyone else in the department. She had made herself the most visible target without knowing it, through nothing more than showing up and doing her job. And he'd let it happen. More than let it. He'd cleared the way for it by not sharing what he knew with the investigators. The part that sat worst was not the accusation itself. It was the 11 reports sitting in his email inbox, documented, time-stamped, ignored, and the fact that he had looked at her that morning and said, "It's a precautionary measure," with a face that showed no discomfort at all. At 11:40 a.m., Dr. Farrow stepped out of Bay 3 and said, to no one in particular but loud enough to carry down the corridor, "The pneumothorax has resolved. He's going to be fine." Specialist Diekman made a sound that was mostly relief and slightly tears, which she covered by drinking the rest of her coffee very fast. Sergeant Price, who had been standing at the end of the corridor for the past hour doing something on a tablet, looked up and nodded once, which was apparently the military handler equivalent of the same reaction. Emily sat with the news for a moment. Then she stood, put weight on her leg, and walked back into the bay. Ranger lifted his head when she came in. He looked better, eyes clearer, breathing even, the panic edge gone from his body language. He still tracked her as she crossed the room. "You scared me," she told him. He put his chin down on the pad. "Yeah," she said. "You're welcome, Bob." What broke the held breath was a knock on the door of Bay 3 at 12:17 p.m. Not a soft knock, but a purposeful one, followed immediately by the door opening before anyone answered it, which meant it was either a physician or someone who outranked physicians in their own estimation. It was Deputy Marcus Holt. He stepped into the bay, took in the dog on the transport pad, Emily beside him, and the general arrangement of the room with the flat gaze of someone cataloging information. He had a folder in his hand. He looked at Emily with the same expression he'd worn that morning, not hostile exactly, but certain. The certainty of a man who hadn't yet encountered the information that would require him to revise it. "Ms. Voss," he said, "I need you to come with me." "I'm monitoring a patient," Emily said. "The animal is stable. I've been informed." He held up the folder slightly. "We've received additional documentation from the hospital compliance office. Given the volume of transactions attached to your access code, the DA's office has agreed to move forward with a formal—" The door opened again behind him. Captain Reyes walked in. He was not alone. Behind him was a woman Emily didn't recognize, late 40s, tailored jacket, the deliberate neutral expression of someone in federal oversight. And behind her was the hospital's IT director, a man named Foster Grund, who looked like he had spent the past 2 hours being asked questions he hadn't expected, and had arrived at the answer to all of them approximately 40 minutes ago. Holt turned. He looked at the three of them. Some of the certainty shifted. "Deputy," Reyes said pleasantly, "I'm glad you're here. Mr. Grund has something to share with you." Grund looked at his tablet. He looked at Holt. He had the expression of a man who was about to say something that was going to make his afternoon very difficult, and he had apparently made peace with that. "The dispensing software," Grund said. "We found it, the duplication error. It's not random. It triggers under a specific combination of simultaneous access events that only occur during high-traffic shift changes. We can reproduce it. We can also demonstrate that it has been generating phantom transaction records in 7 departments, not 3, for the past 8 months. He paused. The transactions attached to Ms. Voss's access code, he said carefully, are consistent with a user who works high-traffic shifts across multiple bays. They are not consistent with any pattern of deliberate falsification. The quantities match the duplication signatures exactly. Holt's folder stayed in his hand but stopped meaning anything. 8 months, Emily said quietly. 8 months, Grund confirmed. He didn't look at her directly. She understood that. He was the man who had run the surface diagnostic 9 weeks ago and told Fitch the system was clean. Being in this room was already costing him something. The woman in the tailored jacket said, "Deputy Holt, I'm investigator Lena Marsh, State Healthcare Fraud Division. We've been in contact with your DA's office for the past 90 minutes. Given Mr. Grund's findings, the referral is being reviewed." She said it the way people in her position said things, without inflection, with finality. "We'd like to discuss several matters with you, including what information was available to hospital administration and when." Holt looked at Marsh. He looked at Reyes. He looked, finally, at Emily, and something crossed his face that was not quite guilt and not quite apology, but existed in the territory between them, the uncomfortable country that people occupy when they realize their certainty was borrowed from someone who shouldn't have been trusted with it. He said nothing. Emily looked at Ranger instead. The dog had watched the entire exchange with his chin on the transport pad and his ears moving between voices, tracking the conversation with the practiced attention of an animal trained to read human tension. His breathing was steady. She put her hand on his flank. She did not look at Holt again. But from the corridor outside Bay 3, where Specialist Diekman and Sergeant Price had both gone very still when the voices inside shifted tone, there was the sound of someone's radio crackling to life, and then the sound of Renata Diaz's voice coming over the hospital intercom, sharp, urgent, stripped of the careful neutrality she'd been wearing all morning, saying, "Emily Voss to the trauma bay. Emily Voss, trauma bay now." Emily's head came up. Ranger's ears pinned forward. "What's in trauma?" she said to no one in particular, already moving toward the door. Nobody answered fast enough, and she was already through it. The trauma bay was 40 feet down the main corridor, and Emily covered it in 20 seconds, which was fast for someone with a carbon fiber brace and a leg that didn't cooperate in cold weather, but she'd learned years ago that urgency had a way of overriding the body's objections long enough to get the job done. What she found when she pushed through the trauma bay doors stopped her for exactly one beat. The patient on the table was a man in his mid-50s, heavy-set, in civilian clothes that had been cut away to expose a chest that told a complicated story. 2 nurses were already working, one managing an IV line that wasn't cooperating, one trying to get a blood pressure reading from an arm that kept moving because the patient was conscious and agitated and convinced, apparently, that he needed to be somewhere else. Dr. Kelsey Ahrens was at the head of the table with her hands moving through a rapid assessment and her face set in the particular expression she wore when a situation was worse than the incoming report had suggested. "Blunt chest trauma," Ahrens said without looking up. "Car versus guardrail on Route 9. EMS got him in 4 minutes, but his pressure's been dropping since they loaded him. SAT is 89 and falling." Emily was already moving to the left side of the table. "What do you need?" "I need another set of hands that know what they're doing, and I need them not to be a student." Ahrens finally looked at her. There was no hesitation in it. "You're here, your hands are clean, and I'm not asking for your badge number." The nurse managing the IV, a young man Emily recognized as one of the newer hires, 3 months in, name tag reading Pell, looked up with an expression that was equal parts relief and anxiety. The IV line was a problem. The patient's veins were difficult. The right antecubital had blown, and Pell had been attempting a second site on the forearm with the careful anxiety of someone who knew the stakes and was letting that knowledge make his hands less steady. "Step back," Emily said, not unkindly. "Get me a 16 gauge and the ultrasound probe." Pell stepped back. Emily took his position, felt along the patient's inner arm with 2 fingers, found the vein she wanted not where convention said to look, but slightly medial and deeper. The kind of site that only showed up if you knew to look for it because you'd been working difficult access in field conditions where the standard sites were routinely compromised. She had the line in within 40 seconds and the IV running in 10 more. The patient, she still didn't have a name, turned his head toward her. His eyes were the pale gray of someone who'd gone into early shock but hadn't tipped all the way yet, which meant there was a window. "My wife," he said. She was in the car. She's being cared for, Emily said, which was what you said when you didn't know yet and needed the patient to stay calm. What's your name? Warren, he said. Warren Tillis. Warren, I need you to stay very still. Can you do that? He tried. He was the kind of man who had probably spent his whole life being useful in crises and was finding it profoundly disorienting to be the crisis. He kept his hands flat on the table with visible effort. Aaron said, from the head of the table, his breath sounds are unequal. Left side is diminished. Emily had already heard it. She'd had her hand on his chest when Aaron said it, feeling the asymmetry and expansion that she recognized from 2 hours ago in a different bay with a different patient who also happened to be breathing with only part of his left lung. The universe had a dark sense of repetition today. Tension pneumothorax, Emily said. That's what I'm thinking. Aaron's looked at the monitor. Pressure is 80/50 and moving the wrong direction. We need to decompress. I can do it. A beat. In the room, there were now 4 people. Aaron's, Emily, Pell at the equipment cart, and a second nurse named Chandra, who was managing the monitor leads. The question in that beat was not whether Aaron's trusted Emily's clinical judgment. The question was whether anyone in this room was going to say the word suspended and make the next 3 minutes a legal problem rather than a medical one. Nobody said it. Aaron said, second intercostal mid-clavicular line. Go. Emily went. The needle decompression took 45 seconds. The rush of air confirmed the diagnosis. Warren Tillis's oxygen saturation climbed from 89 to 94 in under 2 minutes, and his blood pressure, when Chandra called it out, had moved from 80/50 to 102/68, which wasn't good but was survivable and moving in the right direction. He needs a chest tube, Emily said. He needs a chest tube and a CT and probably a cardiothoracic consult, Aaron's agreed. But right now he needs to get to 3 minutes from now without his pressure tanking again. She looked at Warren, who was breathing with less visible effort and had stopped trying to sit up. Warren, we've relieved the pressure in your chest. You're going to feel a little better in a moment. Does anything else hurt? My ribs, he said. Left side, and my... He stopped. Is my wife here? Someone is finding out right now, Aaron said. She looked at Chandra. Find out about the second car from that accident. The chest tube took longer than the decompression, and it wasn't clean. Warren Tillis had the rib anatomy of a man who'd broken ribs before and healed imperfectly, which meant the landmarks were slightly off, and the first attempt placed the tube in a position that drained adequately, but not optimally, and Emily had to make a judgment call about whether to reposition it or accept adequate and move him to CT. She accepted adequate. The risk of a second placement in a patient whose pressure was still borderline outweighed the benefit of optimal positioning, and she said so to Aaron's, who nodded once. Document your reasoning, Aaron said. I know. What Emily didn't say, what she was aware of in the back of her mind while her hands were doing the work that needed doing, was that she had no documentation privileges right now. She had no active access. Whatever she wrote in this chart would carry an asterisk that some administrator was going to notice. And the fact that she'd just performed 2 procedures on an unstable patient while suspended was going to be a conversation she'd have to have later in a room with people who had legal pads. She made the call anyway. She had made calls in worse conditions with more at stake, and she was not going to let Warren Tillis tip into hemorrhagic shock because she was worried about her paperwork. She documented everything in the physical nursing notes, in handwriting that was small and precise and legible. The way she'd been taught to write in conditions where electronic systems weren't available. She noted the time, the indication, the technique, the patient response, and the clinical rationale for every decision. She signed it with her full name. Then she stepped back and let Aaron's take over for the CT coordination, and she stood at the edge of the trauma bay and let her hands stop for the first time in 40 minutes. They were shaking slightly. Not from nerves. She was past the point where procedural stress made her hands shake. It was the cold and the nerve damage, and the fact that she'd been running on nothing but the coffee she hadn't finished since 5:30 in the morning. She pressed them flat against her thighs and waited for it to pass. Pell appeared at her elbow with a bottle of water. He held it out without making it a moment. She took it. Thank you. You found that vein in like 30 seconds, he said. 40. I was on that arm for 4 minutes. You were being careful, Emily said. Careful is right. You just have to also be fast. She looked at him. Next time, try going slightly medial from the standard site on difficult forearm access, deeper than you think. The vein runs close to the flexor. He nodded, committing it. She recognized the specific quality of his attention. He was the kind of person who learned from watching rather than being told, and who stored information in the body rather than on a notepad. He'd be a good nurse in a year, maybe less. The trauma bay doors opened and Captain Reyes walked in, followed by Investigator Marsh, which was a combination of people that made Erin's look up sharply from where she was coordinating the CT transfer. "This is an active trauma bay," Erin said. "I know," Reyes said. "I apologize. We need 60 seconds. He looked at Emily. "The hospital board has been notified. Mr. Fitch has been asked to step out of his office pending a review." The room processed this at different speeds. "On what basis?" Emily asked. "Marsh's office subpoenaed the administrative email archive an hour ago. IT pulled the delivery confirmations on your reports, all 11, and cross-referenced them with Fitch's calendar and his response record. He opened 7 of your reports. He flagged 3 of them internally as low priority, no action required, on the same day he received them." Reyes paused. "He also sent an email to Sandra Veen 3 weeks ago instructing her that if a narcotics audit was triggered, to begin with Bay 4 access logs." The specific coldness of that landed in the room. Bay 4. Her bay. Her code. Not because she was guilty, because she was visible, because she had filed 11 reports that created a paper trail that Fitch needed to point away from himself. And the easiest way to point was at the person who had been loudest about the problem. Discrediting the reporter discredited the report. It was not complicated, it was just mean, in the particular institutional way that meant was when it wore a suit and used procedure as its instrument. "He knew the software error touched 7 departments," Emily said. "He knew," Marsh confirmed. "We have internal memos. He'd been managing it quietly because a full disclosure would have required him to explain why routine maintenance flagged the issue 8 months ago and he declined to act on it. The estimated cost of fixing it was in the capital budget request he cut last fiscal year." She said it flatly. He was protecting a budget decision. Warren Tillis, from the transport gurney as the CT team was beginning to move him, said, "I don't know what any of that means, but that nurse saved my life, and I'd appreciate if everyone in this room knew that." It was not timed for effect. He simply said it because it was true, and he was the kind of man who said true things when he had the chance, and the room went briefly quiet in a way that had nothing to do with procedure. Erin said to the CT team, "Let's go." And the gurney moved, and Warren Tillis went with it, and Emily watched him go and stood in the space he left behind. The next hour had a different quality than the morning had. Less the held breath of waiting, and more the particular vertigo of a situation that was moving faster than anyone had planned for. Investigator Marsh set up in an unused consultation room off the main corridor and began working through the administrative archive with 2 colleagues who arrived from the state office carrying laptops and the particular focused energy of people who'd been handed something they could actually use. Reyes coordinated between them and the 114th's legal office by phone, which required him to have several conversations in the corridor that he conducted in the low, rapid shorthand of someone used to communicating classified information in semi-public spaces. Deputy Holt had not left the building. Emily saw him twice in the corridor, once standing outside the consultation room with his arms crossed and his folder still in his hand, looking at the door with the expression of a man watching his morning certainty get dismantled piece by piece. Once at the nurse's station, talking to Renata Diaz in a voice too low to hear, though Renata's face during the conversation said enough. She had the expression of someone being told they'd made a decision that morning they were now going to have to own. The hospital's vice chair of the medical board, a physician named Dr. Anatole Kern, arrived at 1:15 and went directly into Gerald Fitch's office, where Fitch was still present despite having been asked to step out. The conversation that followed was audible in the corridor in fragments. Not words, but tone. The specific rising and falling of voices when someone is being confronted with documented evidence and running out of alternative explanations. Emily heard it from the nurse's lounge, where she had gone to sit for 15 minutes because her leg had reached the point of protest that required her to stop moving or accept the consequences. She had her brace off and her hand pressed against the nerve cluster below her knee that produced the worst of it. Doing the specific rhythmic pressure that wasn't quite massage and wasn't quite anything with a medical name, but which her body had taught her, worked well enough to take the edge off. Renata found her there. She came in and closed the door and stood against it for a moment without speaking, which was unusual for Renata, who was a person who filled silences efficiently. "Fitch is being walked out," she said finally. Emily looked at her. "Kern called security. Not dramatically. They're not doing it in the main lobby, but he's leaving the building." Renata crossed to the chair across from Emily and sat. She looked tired in a way that went past the shift. "I need to say something to you." "Okay." "This morning, when Holt asked for somewhere for you to wait." Renata stopped. She had the expression of someone choosing between several true statements and trying to find the one that was most accurate rather than the one that was most flattering to herself. "I could have pushed back. I chose not to." "I know," Emily said. I'm not asking you to say it's fine." "It's not fine," Emily said, "but I understand it." She looked at her hands. "You had 11 other things happening, and you made the call that caused the least friction. I would have made the same calculation in your position. I wouldn't have liked it either." Renata was quiet for a moment. "You filed 11 reports." "Yes. I saw maybe 3 of them come through. I forwarded them to Fitch." "I know you did." "I should have escalated when he didn't respond." Emily said nothing to that because Renata was right, and saying so wasn't going to help either of them, and saying it wasn't true would have been a lie. She pressed her hand against her knee and waited for the nerve to settle. "The board is going to reinstate your access," Renata said. "Kern told me directly. They're treating this as an emergency corrective action." She paused. "He also said, and this is his word, not mine, that the hospital is going to have to do something meaningful to address what happened. Not just with you, with the culture that let Fitch do what he did for 8 months. "That's a large project," Emily said. "I know. Are you up for it?" Renata looked at her. "Are you?" Emily put her brace back on. She worked the fasteners with the practiced efficiency of someone who'd done it 10,000 times, and she stood up, and she put her weight on her leg, and she waited for it to hold. It held. "Ask me again when I have my badge back," she said. Well, her badge came back at 2:47 p.m. Dr. Kern brought it himself, which she suspected was deliberate. The same hand that had authorized suspending her access, now physically returning it. A gesture that was either genuine accountability or optics management or both. Kern was a careful man. She didn't know him well enough to know which it was, and she decided not to spend the energy trying to figure it out. She clipped the badge to her scrub top and went back to work. The afternoon was busy in the way that Tuesday afternoons in March were busy at Hargrove Memorial, a steady flow of routine cases with occasional spikes, the kind of workload that required sustained attention without the adrenaline of a true emergency. Emily moved through it the way she always moved through work, efficiently, quietly, with the particular focus of someone who was most comfortable when the task in front of them was concrete. Medications, assessments, IV management, the 1,000 small decisions that made up a nursing shift. She checked on Warren Tillis at 3:30. He was post-CT in a monitored room on the 2nd floor with 2 fractured ribs confirmed and the pneumothorax resolved. His wife, who had been in the car and had walked away with a lacerated forearm and a concussion, was sitting beside his bed when Emily looked in. Warren saw her in the doorway and said, "There she is," to his wife, with a certainty that made his wife turn and look at Emily with the exhausted gratitude of someone who had been very close to a much worse afternoon. Emily said, "Good color. How's the pain?" "Manageable," Warren said, "on a scale. 6, maybe 7. I'll have someone check your pain management order." She looked at the chart briefly. "You did well. Staying still when I asked. You had a good bedside manner," he said. "Confident. I trusted you." She nodded and left because staying longer would have made it something she didn't want it to be. She went to the nurse's station and updated his pain management note and moved to the next thing. At 4:15, Captain Reyes found her in the corridor outside Bay 2. "Marcia's office is filing a formal complaint with the State Healthcare Administration Board," he said. "It'll trigger an audit of Fitch's tenure. The dispensing software vendor has been notified and they're sending a remediation team. All 7 affected departments will have their records corrected." "And Holt?" Emily asked. Reyes considered this. He filed a report this morning that he'll need to formally retract. Whether anything further comes of it depends on what his office decides about his conduct. He paused. He came and found me an hour ago. He wanted me to know he understood he'd made assumptions he shouldn't have. He told you that. He did. Emily looked at the wall for a moment. It's not enough, she said. I know that's complicated because I think he probably means it. But a person lost their job today because of a referral that went forward on bad evidence. And the referral went forward in part because he was confident without being careful. That has a cost. I agree, Reyes said. I think he's starting to understand that. Starting isn't the same as understanding. No, it's not. She looked at him. What happens to your unit now? With Ranger Stable? We'll move him to the base veterinary facility in 3 days when Farrow clears him for transport. She's agreed to monitor him until then. He paused. He's going to be all right, Voss. I know. Do you know that? Or are you saying it? She almost smiled. Both. He studied her for a moment. I'd like to have a conversation with you in the next few days, not about today, about a program the 114th is developing, veteran and first responder rehabilitation, integrated with animal-assisted recovery. We've been looking for someone with dual clinical and field experience to help design the protocols. He said it neutrally, without pressure. It would be part-time initially. You wouldn't have to leave Hargrove. Emily looked at him. The afternoon light through the corridor windows was the flat gray of a Colorado winter, and the hospital smelled like antiseptic and the specific warmth of an indoor space that was always too full of people, and somewhere down the corridor she could hear the beeping of a monitor being adjusted. I'll think about it, she said. That's all I'm asking. He left. She stood in the corridor for a moment, her badge on her chest and her brace on her leg, and the particular quiet of a person who has been through a great deal in a single day and is not yet sure what shape it's going to leave behind. She went back to work. At 6:18 p.m., 47 minutes before the end of her shift, the overhead intercom in the corridor crackled and went live, and the voice that came through it was not Renata's and was not the standard dispatch tone. It was a voice Emily recognized but hadn't expected to hear in the building, Sandra Veen, the compliance officer, who had been in the building all day and who Emily had seen twice in hallways and deliberately not spoken to. Code Blue, the intercom said. Administration Wing. Code Blue. Administration Wing. Emily's head came up. The administration wing was on the second floor. It was not a patient area. It was offices and conference rooms, and the kind of institutional carpeting that absorbed sound and made everything feel simultaneously muffled and tense. Code Blue in the administration wing meant someone who was not a patient was in cardiac arrest. She was moving before the intercom finished. She took the east stairs 2 at a time. Her leg protested, and she ignored it, and came through the second-floor door into a corridor she didn't usually work in, following the sound of voices and the distinct chaos with purpose of people responding to an emergency in a space not designed for it. The crash cart was being pushed from the supply closet at the end of the hall by a facilities worker who clearly knew where it was, but had never actually needed it before. 2 administrative assistants were standing against the wall with the stunned expressions of people watching, something their brains were refusing to categorize. And in the middle of the corridor, kneeling over a man on the floor, was Dr. Kern, who had his hands already positioned for compressions and his face set in the expression of someone who was going to do this properly, even if it cost him everything he had. The man on the floor was Gerald Fitch. He was gray. His mouth was open. His tie had been loosened by someone and his shirt collar was askew, and he looked, on the floor of the hallway outside his own office, fundamentally unlike the careful, managed man who had sat across from Emily that morning and taken her badge with no visible discomfort. Emily reached Kern in 4 seconds. She dropped to her knees on Fitch's other side without hesitating and said, "How long?" 2 minutes, maybe 3. He collapsed in the stairwell. Someone called it in. Any rhythm? V-fib on the AED when they first put it on. It shocked once, no conversion. Emily looked at the AED, which was still attached and reading. The rhythm strip was chaotic, still ventricular fibrillation, the heart producing electrical activity without mechanical function, the body's electricity running without the engine. "We shock again," she said. "Agreed." The crash cart arrived. Emily took compressions while Kern managed the AED, and they worked in the wordless coordination of 2 clinicians who didn't know each other well, but knew the protocol well enough to find each other's rhythm in under 30 seconds, and the corridor filled with the sound of compressions and the flat instructions of the AED voice prompt, and the terrified hovering of people who didn't know what to do and were doing the right thing by staying out of the way. The second shock delivered at the 2-minute mark. The rhythm strip changed, not to normal sinus, not to clean and organized cardiac function, but to something, an irregular, struggling beat that was better than what had been there, better in the specific way that meant the heart was trying. The machinery was attempting to reassemble itself. "We have something," Kern said. "Keep going," Emily said. She was still doing compressions, 30 and 2, 30 and 2, the count running in the back of her mind like a metronome she didn't have to think about anymore. "We need an airway," someone behind her said. "I've got a bag valve mask from the cart." She didn't look up. "Then use it." The rhythm steadied, fragile, irregular, but present. Gerald Fitch, the man who had taken her badge, who had routed the investigation toward her deliberately, who had buried 7 departments' worth of corroborating evidence to protect a budget line, was alive because Emily Voss's hands were on his chest, and she was not the kind of person who made calculations about who deserved saving. She was the kind of person who just saved them. The paramedics came through the stairwell door 40 seconds later, and Emily stepped back to give them the space, and she stood against the wall with her hands at her sides, and her legs shaking from the position she'd been in on the floor, and she watched them work. Kern appeared at her shoulder. "Good call on the second shock," he said. Emily didn't answer. She was watching the paramedics stabilize Fitch for transport, and she was thinking about something she couldn't quite name, something about the specific nature of doing right by someone who had done wrong by you, the way it didn't feel like victory and didn't feel like loss, but existed somewhere in the territory between them, where the only thing that was clear was that you had made the only decision you were ever actually capable of making. The paramedics moved Fitch onto the gurney. The corridor began to clear, and then Renata Diaz appeared at the top of the stairs, slightly out of breath, and looked at Emily across the emptying hallway with an expression Emily couldn't immediately read. Not quite shock, not quite relief, and said, "Emily, there's someone downstairs at the front desk." She stopped. "He says he's the original handler for K97. He drove 3 hours. He says he heard. He doesn't even know how he heard, but he's here." She paused again. "He's asking for you by a different name." Emily looked at her. "He said to ask for Iron Grace," Renata said. "He said you'd know what it meant." The hallway was quiet. From somewhere below them, through the floor and the walls and the institutional sound dampening of a building that had seen too much today, came the distant sound of Ranger moving in Bay 3, his nails on the transport pad, the particular restless shifting of an animal who had been still long enough and was ready to be somewhere else. Emily stood in the second-floor corridor with her badge on her chest and her hands still, and she had not heard that name in 6 years. She took the stairs down, not because the elevator was far, but because she needed the 12 seconds it took to descend 1 floor. The particular friction of each step against the brace, the cold railing under her right hand, the sound of her own breathing in the stairwell, to do something she hadn't done all day, which was nothing. Just 12 seconds of nothing before whatever was waiting at the front desk became real. She pushed through the stairwell door into the main lobby and stopped. He was standing at the reception desk with his back to her, which gave her a moment to look at him before he knew she was there. He was tall, taller than she remembered, though she understood that memory compressed people when enough time had passed. His hair had gone gray at the temples in a way that aged him correctly, not more than the years warranted. He was in civilian clothes, but stood the way people who have been military for a long time stand even when they're dressed like they're going to the hardware store, weight balanced, shoulders level, the unconscious readiness of a body that had been trained to respond and never fully untrained itself. He had a duffel bag at his feet. He'd driven 3 hours. He hadn't known if she'd be here. He'd come anyway. "Sergeant Briggs," she said. He turned. Marcus Briggs was 47 years old and had the face of someone who had spent a significant portion of his life outdoors in difficult conditions, weathered without being aged, the kind of face that communicated experience without performing it. He looked at Emily across the lobby, and something moved through his expression that was complicated and quick, and then mostly controlled. "You look the same," he said. "I don't," she said. "No," he admitted, "but close enough. They stood for a moment in the lobby of Hargrove Memorial with the afternoon foot traffic moving around them. A family with a stroller, a man in a cast on his way out, two nurses heading to the break room, and the particular awkwardness of two people who shared a significant history trying to locate the correct register for the present. "How did you find out?" Emily asked. "Reyes called the unit alumni network," Briggs said. "He was looking for anyone with direct field contact with K-97. I was his original handler for 2 years before the deployment where—" He stopped. "Before Meridian Cross." He looked at her. "I heard what happened today. Not all of it, but enough." "Ranger is stable," she said. "Pulmonary contusion and a minor pneumothorax. Farrow has him in Bay 3. He's going to be all right." Something visibly left Briggs's body at that. Not all of the tension, but a specific portion of it, the part that had driven 3 hours on the possibility of a different answer. "Can I see him?" "Yes," Emily said. "Come with me." They walked the corridor toward Bay 3 without talking, which was comfortable in a way that surprised her. She had spent 6 years not thinking about Marcus Briggs, which was different from forgetting him. She had actively not thought about him, the way you actively not think about a room in a house you've decided not to enter. He had been Ranger's handler before she'd known either of them. He had been the person who'd handed her Ranger's emergency care protocol paperwork 6 years ago in a field hospital, 3 days before she'd left the theater, and said, "Put your name on this. He trusts you. That matters." She had put her name on it without fully understanding that she was agreeing to a phone call years later in a Colorado parking lot. Dr. Farrow was still in Bay 3. She looked up when Emily came in with Briggs, took him in with a practiced assessment, and said, "Handler?" "Original handler," Briggs said, 2 years before his last deployment. Farrow stepped back from the transport pad. "He's doing well, breathing is normal, saturation is holding at 97. He'll need restricted activity for 10 days and monitoring for any recurrence of the pneumothorax, but structurally he's sound." Briggs looked at Ranger. Ranger looked at Briggs. The recognition was there. Emily could see it in the way the dog's ears moved, the slight lift of his head, the repositioning of his body toward the familiar person. But it was different from the way Ranger had responded to Emily. With Briggs, it was the recognition of a known person, warm and real. With Emily, it had been something more specific, the recognition of the person who had been there at the worst moment, which was its own category. Briggs crouched beside the pad and put his hand on the dog's neck, and Ranger pressed into it, and neither of them said anything, which was the correct response. Emily watched from across the bay. She felt the particular emotion of witnessing something that was someone else's to feel, not hers, but real and significant, worth the space it took up. After a moment, Briggs looked up at her. "I heard what you did for him 6 years ago," he said. "In month 6, during the extraction. I was stateside by then. I got the briefing later when my clearance allowed it." He stopped. "Nobody told you that people heard about it?" "No," Emily said. "They did," he said simply. "The people who were there told the people who weren't. That's how it works." He stood. "I should have found you sooner. I thought about it and I talked myself out of it because I didn't know what I'd say." "You're here now," she said. "Yeah." He looked at Ranger again. "What do I say to that?" "Nothing," Emily said. "You don't have to say anything. Sup?" She left Briggs with Ranger and went back to the corridor where the late afternoon had settled into the specific rhythm of a hospital approaching shift change. The accumulation of handoff notes, the tired precision of people transferring information to the people coming in. The systems reasserting themselves after a day that had been, by any measure, structurally abnormal. Investigator Marsh found her at the nurse's station at 4:55. "We're done for today," Marsh said, "but I want you to know where things stand." She had the direct economy of someone who had learned to deliver complex information quickly and accurately. The administrative email archive produced documentation of Fitch's decision-making going back 14 months. The initial software flag came from the vendor's own diagnostic in October of last year. Fitch received it, noted it was a cost item, and closed it without action. Every subsequent report, yours, pharmacies, radiologies, was received and logged and deliberately set aside. Emily said, "He was managing the liability exposure. He was managing it by waiting for it to resolve or to attach to someone else. When the outside investigators were called in, he moved to accelerate the second option." Marsh paused. "Sandra Veen was not complicit. She acted on the information she was given, which Fitch had curated. She's cooperating fully. What happens to Fitch? That's not my office's determination. We refer to the DA. Given the documented intentionality, the email to Veen, the suppression of the corroborating reports, the sequence of decisions, the DA will make their own assessment, but the referral will be substantial. Marsh looked at her. Your professional record will be formally cleared by the board's emergency session tomorrow morning. I've been told Kern is personally overseeing that process. Emily nodded. One more thing, Marsh said. She produced a document from her jacket. Not physically dramatic, just a printed sheet folded once. This is a formal request from the State Healthcare Administration for your testimony as a material witness in the subsequent audit of Hargrove Memorial's administrative practices. You don't have to decide today, but I want you to know you'll be asked. Emily took the document. She looked at it briefly, the official letterhead, the case number, the list of matters under investigation, which was longer than she'd expected. I'll testify, she said. You don't need to decide. I know. I'll testify. She folded the document and put it in her scrub pocket. I filed 11 reports. I'd like the record to reflect that they were heard eventually, even if it took a state investigation to do it. Marsh studied her for a moment. You're not angry, she said. It wasn't quite a question. Emily considered this. I'm something, she said. I don't know if angry is exactly the right word for it. What is the right word? Tired, Emily said. And still here. Marsh nodded once and left. Gerald Fitch survived his cardiac event. Emily learned this at 5:40 from Dr. Kern, who appeared at the nurses' station with the information delivered in the careful tone of someone navigating the ethics of what to disclose and to whom. He told her that Fitch was in the cardiac ICU at Ridgemont Medical across town, that the intervention in the second-floor corridor had been clinically decisive, and that the cardiology team expected a full recovery. They said the response time was exceptional, Kern said, and the decision to reshock was the right call. The rhythm supported it, Emily said. It did. Kern paused. I want to be clear with you, Ms. Voss. The board is aware that you performed clinical interventions today while your access was suspended. We're treating both the needle decompression in trauma and the resuscitation in the second-floor corridor as emergency exceptions under the hospital's duty to act provisions. There will be no adverse action. I know, Emily said. I want you to hear it explicitly. Thank you, she said. She meant it, though not effusively, because Kern was doing the right thing and she wasn't going to perform gratitude for the correct institutional response. Is there anything else you need from me tonight? No. He paused again. Ms. Voss, what you did upstairs. For Fitch. He stopped, seemingly uncertain what he was trying to say. I want to acknowledge that that given the circumstances, he was in cardiac arrest, Emily said. There was a crash cart. Yes. Then that's the whole of it, she said. There isn't another version. Kern looked at her for a moment with the expression of a man reassessing something he thought he'd already categorized. He nodded and walked away. Emily turned back to the nurses' station and finished her shift documentation. Marcus Briggs found her in the parking lot at 6:43. She was at her car, bag over one shoulder, keys in her hand, standing still for a moment in the cold, because her leg had been protesting steadily for the past 2 hours, and the cold that had tightened everything that morning had not improved. She was doing the calculation she did at the end of hard days. How much of what hurt was the nerve damage, and how much was muscle fatigue, and what the ratio meant for how she'd feel in the morning. She heard him coming across the lot. His footsteps were the particular kind that didn't announce themselves as surveillance, just presence. Your shift's over? He asked. I'm going to stay in Dunmore tonight. Farrow said she'd call if anything changed with him. He stopped beside her car. The parking lot lights were coming on in the early dark of Colorado March. I talked to Reyes while you were finishing up. He's thorough, Emily said. He told me about the program, the rehabilitation initiative. Briggs looked at the middle distance. He said he'd offered you a role in the design phase. He mentioned it. Are you going to take it? Emily looked at her keys. The carbon fiber of her brace caught the parking lot light in a way that made it look less medical and more structural, which was accurate. It was, in the end, the thing that kept a part of her upright. I don't know yet, she said. I like my job here. The patients are real and the work is concrete, and I'm good at it. You're better than good at it, Briggs said. I watched you work today. Not the Fitch thing. Reyes told me about the trauma bay, the chest decompression, the line placement. He paused. The field work is still there, in how you move, in how you think. The field is a long time ago. Maybe, he said. Or maybe it's just a different field now. She looked at him. He was not a man who spoke abstractly as a habit. He said things because he'd thought them through, which made the few things he said land with more weight than they might have otherwise. You drove 3 hours, she said. I did. For Ranger. For Ranger, he agreed, and to tell you something I should have told you before I talked myself out of it. He looked at her directly, which was the thing about Briggs she had both respected and found difficult 6 years ago. He didn't deflect. What you did during Meridian Cross, the night of the extraction. You were injured before it started. You didn't report it until it was over. 4 hours. 11 soldiers and 2 dogs, including Ranger. He stopped. When I got the full briefing, I tried to find out what happened to you afterward. All I got was that you'd been medically retired. I couldn't get past that. The retirement was correct, Emily said. The leg wasn't going to get better. I know that. I mean what happened to the recognition, the commendation that got classified, the fact that you came out of that theater as a civilian and nobody... He stopped. Nobody said anything, publicly, about what you did. The parking lot was quiet. A car pulled out of the row behind them and the headlights swept across them briefly and then were gone. I didn't need it said publicly, Emily said. Maybe not, Briggs said, but it should have been said. She didn't answer that. There was no answer that was both true and simple, and she didn't have the energy for complex tonight. I'll be at the Dunmore Comfort Inn, he said, room 114, if you want to keep talking. He picked up his bag. If you don't, I understand that too. He walked back toward the visitor lot. She watched him go, and then she got in her car, and she sat for a moment with her hands on the wheel, in the now familiar position of someone processing a day that had accumulated more events than any reasonable Tuesday had a right to contain. She drove home. But the morning came in the specific gray of a Colorado March that couldn't decide whether it was going to snow again. Emily was back at Hargrove Memorial by 6:15, 14 minutes before her shift, because that was how she operated, and one abnormal Tuesday wasn't going to change it. The hospital felt different and also exactly the same, which was the thing about institutions. They absorbed events and continued forward with the same fluorescent lighting and the same antiseptic smell and the same hum of systems that never fully stopped. The difference was in the people. There was a quality of awareness in the hallways that hadn't been there yesterday morning. The particular heightened attention of a workplace that had watched something happen and was still processing what it meant. Renata handed her the shift briefing at the nurse's station with a directness that was itself a form of normalizing, treating Emily's presence as unremarkable, which was the most useful thing Renata could have done and probably the thing she'd decided on overnight. Warren Tillis is being discharged this afternoon, Renata said. His wife was cleared last night. Kern is holding a department heads meeting at 10 to discuss the audit process. She paused. Holt's supervisor from the sheriff's office called the hospital this morning. They want to issue a formal statement. Kern's office is coordinating. Okay, Emily said. Also, Renata said, and her voice changed fractionally. Not softer exactly, but with a different quality. There are people who want to apologize to you, from yesterday. Some of the staff who didn't say anything when they should have. She looked at Emily. I told them you were on shift and working, and they should use their judgment about whether it was the right time. That was the right call, Emily said. Tell them I appreciate it, but the work is more important than the conversation. That's very you, Renata said. Is that a criticism? No, Renata said. It's actually the best possible response, and I'm going to tell them that. Emily took the briefing and went to start her rounds. The board's emergency session convened at 9 a.m., and Emily learned its outcomes not from being in the room, but from Kern appearing in the corridor, outside Bay 2 at 9:53, with the specific purposeful walk of someone carrying information. Your record has been formally cleared, he said, unanimously. The board has also voted to commission an independent audit of all administrative decisions made by Fitch's office over the past 14 months, with particular focus on safety reports and maintenance deferrals. He paused. They've also voted to implement a new escalation protocol for clinical safety reports. 3-day mandatory response, Automatic escalation to the board. If department heads don't act, independent tracking systems separate from the administrative chain. Emily said, that should have existed already. I know, Kern said. I'm not going to defend the fact that it didn't. He met her eyes. The board is also recommending a formal commendation for your response to both the Trauma Bay situation and the second floor code. It'll go in your permanent record. I'd rather have the escalation protocol, Emily said. Kern looked at her. You can have both. Then yes, thank you. He started to leave. Dr. Kern, she said. He stopped. Fitch is going to be discharged from cardiac ICU in a few days, she said. When the legal process moves forward, the DA referral, he's going to need representation and time and the full due process the system provides. I want that to happen correctly. She said it without softness and without hardness. I want him held accountable by a proper process, not a fast one. There's a difference. Kern studied her. Most people in your position would want speed. Most people in my position haven't sat in a waiting room for 40 minutes while their career got dismantled and then spent the afternoon saving the person who dismantled it. She looked at him. I know what proper process feels like from the bad side. It should feel correct from the other side, too. Kern was quiet for a moment. Then he said, I'll pass that on, and left. At 11:20, Deputy Marcus Holt walked into Hargrove Memorial without a folder in his hand. He found Emily at the nurse's station. He stood across the counter from her with the body language of a man who had rehearsed this and knew the rehearsal wasn't going to survive contact. He was not in uniform, which she hadn't expected. I'm here personally, he said. Not officially. My official statement goes through Kern's office. He stopped. I need to say something directly to you. Emily set down the chart she was updating. She looked at him. I made assumptions, he said. I walked in here yesterday with a narrative I'd gotten from Fitch's compliance office, and I fit everything I saw into it. Your hands shaking, the way you walked. I decided those things meant something they didn't mean. He stopped again. The effort of it was visible. He was not a man who apologized easily, not because he was cruel, but because certainty was what he'd built his working life on, and admitting its failure was structurally costly. I judged before I understood, and I said it out loud in front of your colleagues, which made it worse. Emily said, Yes. I'm sorry, he said. That's not sufficient, and I know that. But I am. She looked at him for a long moment. He held it, didn't look away, didn't qualify, didn't add anything that would soften the discomfort for himself. I accept it, she said, and I want to tell you something in return. She kept her voice level, not forgiving in the performed sense, but honest. The software error generated a pattern that would have looked suspicious to anyone assessing it without the full context. You were working with bad information from a source you had reason to trust. That doesn't make what you did correct, but it makes it comprehensible. She paused. The person who gave you that incomplete information did so knowingly. That's the distinction the process needs to draw. Holt looked at her. You're drawing a line between me and Fitch. I am, she said, because there is one. Don't waste it. He nodded slowly. It was the nod of someone receiving something they hadn't expected and were going to need time to understand fully. My supervisor is recommending a review of our investigative protocols, he said, for how we handle medical workplace complaints. I've been asked to contribute to developing new guidelines. He paused. I'm going to do it. Good, Emily said. He left. She watched him go, the same wide shoulders, the same deliberate walk, but something different in the way he moved through the door, like a man who had put something down that had been getting heavy. She went back to the chart. The piece she hadn't anticipated arrived at 2:15 in the form of Foster Grund, the hospital IT director, who appeared in the corridor outside the break room with the expression of a man who had not slept and was aware that his discomfort was not the most important discomfort in the room. Ms. Voss, he said, I owe you a specific conversation. She waited. 9 weeks ago, he said, I ran a diagnostic on the dispensing system following Fitch's request. I found no anomaly. I told him the system was clear. He looked at his hands briefly. What I ran was the standard surface diagnostic. Your report specified a condition-specific trigger, simultaneous access events during shift changes. I didn't run a condition-specific test because Fitch had described your report to me as a pattern of user error, and I accepted that framing without questioning it. You didn't read my actual report, Emily said. No, he said. I read Fitch's summary of it. She absorbed this. The shape of it completed something she'd been looking at from the outside. The way Fitch had managed the information flow so that each person who might have caught the error was working from a version of the facts that had been trimmed to produce the right conclusion. He hadn't needed to lie to everyone. He just needed to be the intermediary, the one who held the original documents and distributed the summaries. When did you read my actual report? She asked. Yesterday morning. When Reyes's call came in and Marsh's office started asking questions, I went back to the original filing. Grun looked at her. Every specification you described was there. The trigger conditions, the affected access patterns, the recommended diagnostic approach. It was all there in report number 3. He stopped. 8 months ago. Emily said nothing. I'm going to recommend to the board that the hospital engage an external IT auditor, he said. And I'm going to put in my resignation. That's your decision, Emily said. I know, he said. I'm not asking for your opinion on it. I'm telling you because you're the person who was most directly affected by my failure to do my job correctly. He met her eyes. You deserved the truth 8 months ago. I didn't give it to you. I'm sorry. She looked at him. He was not a bad man. She could see that. He was an ordinary man who had been given a trimmed version of the facts by a person in authority and had not pushed past it, which was a failure, and he knew it was a failure, and he was standing here saying so. Resign if you need to, she said. But if you stay, run the full diagnostic next time. Read the original document. That's all it would have taken. Grun nodded. He left. The corridor was quiet. Emily stood in it and thought about how many points there had been. 11 reports, 1 IT diagnostic, 7 departments, 14 months, where the right action by a single person would have collapsed the entire structure before it reached yesterday morning. The number of near misses was architectural. The system had been built, inadvertently or not, with no redundancy for institutional pressure. Every checkpoint had a person in it who was working from Fitch's version of the truth, except her. She had the original. She had always had the original. At 3:40 p.m., Reyes called. I have something I need to tell you, he said, before it becomes public and you hear it from someone else. Emily was in the corridor outside Bay 4. The medication cabinet was behind her, the same one Holt had asked her to open 24 hours ago. She looked at it. Tell me, she said. The State Healthcare Administration audit scope has been expanded, Reyes said. Based on what Marsh's office found in the administrative archive, they're now looking at 3 other facilities in the regional network that Fitch managed before Hargrove. There are indications that the same pattern, suppressed safety reports, deferred maintenance, redirected audits, may have been operating at those facilities as well. Emily was quiet. The first facility, Reyes said carefully, is Clearwater Community Hospital in Grenville. She knew the name, not because she'd worked there. She hadn't. Because Clearwater Community Hospital in Grenville was where a nursing aide had died 18 months ago in a medication error that the official review had attributed to individual user fault. She remembered reading the industry report. She remembered thinking something about it hadn't sat correctly, the way misattributed clinical conclusions didn't sit correctly when the underlying data hadn't been fully examined. The Clearwater incident, she said. Marsh's office believes the safety reporting system there was operating under the same suppression pattern, Reyes said. They can't establish causation yet, but the audit is going to look at it. The corridor felt different around her. How long was Fitch at Clearwater? She asked. 3 years, Reyes said, before he came to Hargrove. She put her hand flat against the wall. The institutional paint was cold under her palm, the same way the medication cabinet door had been cold 24 hours ago when she'd opened it at Holt's request, and the particular coldness of it now felt like something arriving rather than something she was touching, the full weight of what hadn't been seen for 14 months at Hargrove, and possibly longer, possibly wider, possibly reaching into a tragedy in another hospital, in another town, that a family somewhere had been told was an individual's mistake. Emily, Reyes said, I need to ask you something. Ask? When you testify for Marsh's office, and I know you've agreed to, I want to know if you'd be willing to extend that to the broader audit scope. Your documented reporting history at Hargrove is the clearest example we have of how the suppression pattern operated. Walking the investigators through it, step by step, with the original documents, it could be the framework for understanding what happened at the other sites. She stood in the corridor. "You're asking me to be the primary witness in a multi-facility investigation," she said. "I'm asking if you're willing," he said. "There's a difference." She thought about the nursing aide in Grenville. She thought about a family who had been told a story that might not have been the full story. She thought about 11 reports sitting in an inbox and a single IT diagnostic that had never gone past the surface level, and a man who had managed information flows with the quiet competence of someone who understood exactly how much truth any given person could be trusted with. "Yes," she said. "I thought you would," Reyes said. And then, after a pause, "There's one more thing. I got a call 20 minutes ago from the 114th's Public Affairs Office. Someone in the hospital, one of the staff, talked to a local news outlet. About what happened yesterday. About you." Another pause. "They're asking for a statement. The story is already written. It goes live at 6 p.m., whether or not you respond." Emily looked at the medication cabinet. "What does the story say?" she asked. "Right now?" Reyes said. "It says a nurse was falsely accused of stealing medication and cleared after a military investigation. Standard framing. Human interest." He stopped. "But the reporter also filed a request with the State Military Records Office for Operation Meridian Cross." The corridor was very quiet. "That file is classified," Emily said. "Parts of it," Reyes said. "The parts that aren't. The commendation citation, the field medical record summary, the emergency protocol designations. Those are accessible under the Freedom of Information threshold." He paused. "Emily, they're going to find your name, the designation, everything that was public adjacent." She understood what he was telling her. The story at 6 p.m. was a human interest piece about a wrongful accusation. By tomorrow morning, if the reporter filed correctly and the records office processed the request, it would be something different. It would be the designation she hadn't used in 6 years, printed in a local newspaper, attached to her real name, in a city where she had spent 4 years being the quiet nurse in Bay 4 who dragged her left leg slightly and never explained why. Iron Grace. She had buried that name under 4 years of early shifts and cold parking lot walks and 11 ignored reports. She had carried it alone, the way she carried the leg. Not hidden exactly, but not offered. A private structural fact about herself that she'd decided other people didn't need to know, because knowing it would change how they looked at her, and she had spent enough of her life being looked at in ways she hadn't chosen. "What do you want me to do?" Reyes asked. She looked at her badge. The photo on it was 2 years old. She looked younger in it than she was, or maybe she looked the same and just felt older than the photo suggested. The name beneath it read Emily Voss, RN, which was accurate and complete. And also, as of approximately 6 p.m. tonight, no longer the whole of what people in Dunmore, Colorado were going to know when they looked at it. "Nothing," she said. "Let it run." A pause on Reyes's end. "You're sure?" he said. "The story is already written," she said, "and it's true." She took her hand off the wall. "Let it run." She hung up. She stood in the corridor for 3 more seconds, and then she heard, from down the hall, through the institutional walls, faint but present, the sound of the break room television, which someone had left on, and the beginning of the 6 o'clock local news broadcast, and the newscaster's voice saying, with the particular bright clarity of a story that had just made the front of the segment, "A Hargrove Memorial nurse falsely accused of medication theft has been cleared following a military-assisted investigation that has now expanded to encompass multiple regional healthcare facilities." Emily Voss walked away from the medication cabinet. She walked to Bay 4. She had 3 patients to check before shift change, and she was going to check all of them. And she was going to do it correctly, and whatever was coming tomorrow was going to come whether she watched the television or not. She pushed open the bay door, and on the other side of it, sitting in the single chair reserved for family members, with his duffel bag at his feet and a cup of bad hospital coffee in his hand, was Marcus Briggs, who looked up when she came in, and who said with the particular directness of a man who had driven 3 hours and slept in a hotel room and come back, "The reporter called me an hour ago. She has the Meridian Cross citation. She found the handler logs. She knows Ranger was at Meridian Cross." He stopped. She found the entry where I listed you as the person who carried him out of the field hospital. He looked at her steadily. Emily. She has the photograph. Emily's hand stopped on the door. What photograph? She said. The one the embedded photographer took, Briggs said. The night of the extraction. You didn't know he was there. Nobody did. He was behind the barrier line. But he was there. He set down the coffee. It's you, coming out of the field hospital with your leg already like that, and Ranger in your arms. The bay was very still. It's a real photograph, Briggs said quietly. Emily, it exists, and she's going to publish it. The bay was very still. Emily stood with her hand on the door and let the information settle the way she'd learned to let difficult information settle. Not fighting it, not rushing toward a reaction, just letting it find its weight and its shape before she decided what to do with it. It was a skill she'd developed in field conditions, where the first response to unexpected information was almost always wrong, and the second response, taken a breath later, was almost always better. A photograph. Real, taken by an embedded photographer who hadn't been seen, from behind the barrier line on a night 6 years ago, when the only thing she'd been thinking about was getting Ranger across 40 meters of cleared ground without dropping him, because he was 80 pounds of injured dog, and her leg had already stopped working correctly, and she had not yet allowed herself to look down at it to understand why. She had not known anyone was watching. She stood there for 3 more seconds. Then she said, "Who does she work for?" "Dunmore Courier," Briggs said. "Local. But she's already filed the story to the regional wire. If the wire picks it up, it'll run statewide by morning." "Yes." Emily came fully into the bay and let the door close behind her. She pulled the second chair from the corner, the one that technically wasn't supposed to be in the bay, but appeared there periodically because nurses moved furniture to where it was useful regardless of what the floor plan said. And she sat across from Briggs and looked at him. "Can she be asked not to publish the photograph?" Emily asked. "I tried," Briggs said. "She said the photograph is public domain. The embedded photographer released his archive to the wire service 2 years ago when he retired. She found it through the archive search when she pulled the Meridian Cross citation records." He looked at his hands. "She's not being malicious. I spoke to her for about 10 minutes. She thinks she's honoring you." "I know," Emily said. "That doesn't make it what I would have chosen." "No," he agreed. "It doesn't." She sat with that. The photograph was going to run. That was the shape of it. Fixed, coming, outside her control in the way that several things had been outside her control over the past 36 hours. And the only variable was what she decided to do about it rather than to it. "Describe it to me," she said. "The photograph." Briggs was quiet for a moment, and when he spoke his voice had a different quality. Not soft exactly, but careful, the way people are careful with things they recognize as significant. "You're coming out of the tent. Your left leg is dragging. You can see the injury. Your scrubs are... It was a bad night, so there's blood on them, though none of it is yours, or at least not much. Ranger is across your arms." He stopped. "You're not looking at the camera. You're looking at the LZ. You're looking at where you need to get to next." A pause. "You look like someone who's already decided the ground between you and the landing zone is going to get covered. The only question is how long it takes." Emily looked at the wall. "I look terrible," she said. "You looked," Briggs said, "like someone who was still going." She didn't answer that. Outside the bay, she could hear the corridor settling into shift change, the overlap of voices, the handoff rhythm, the sound of a hospital continuing its work regardless of what any individual day had deposited into it. It was a sound she had been listening to for 4 years, and it was, she realized, a sound she found genuinely steadying, not peaceful. A working ER was not peaceful, but honest. The noise of necessary things being done. She made her decision, not dramatically, the way she made most decisions, which was by locating the thing that was true and moving toward it. "I'm going to call the reporter," she said. Briggs looked at her. "I'm not going to ask her not to publish it," Emily said. "I'm going to give her a statement, on record. So the story that runs has my words in it and not just the photograph." She stood. "If people are going to look at that image, they're going to hear what I have to say about it. That's the only control I have, and I'm going to use it." Briggs stood too, not because he was following her, but because sitting while she was standing felt wrong. "What are you going to say?" She thought about it for a moment. "The truth," she said. which is that I was a nurse who did her job under difficult conditions and then came home and kept doing her job under different conditions, and that neither version of the job was remarkable. That every person in that photograph, the ones behind the camera, the ones on the landing zone, the ones still in the tent, did the same calculation I did. That I'm not a symbol. I'm a person with a bad leg and 11 ignored reports and a dog I helped carry out of a field hospital, and all of those things are true at the same time, and none of them cancels the others out. Briggs looked at her for a long moment. "That's going to make a hell of a story," he said. "I know," she said. "That's why I'm going to be careful about every word." She called the reporter from the corridor outside Bay 4 at 6:47 p.m. Her name was Dara Finch, 28 years old, 4 years at the Dunmore Courier, and she answered on the first ring in a way that suggested she'd been waiting. The conversation lasted 19 minutes. Emily stood in the corridor with her back to the wall and her brace against the floor, and spoke with the same flat precision she used for clinical documentation, accurate, sequential, without ornamentation. She told Dara Finch what she wanted told, and she was explicit about what she didn't want told, and when Finch pushed on the parts Emily had designated as private, Emily said simply, "That's not for this story," in a tone that communicated the boundary without hostility. Finch was smart. She worked with it. She had good questions, not the questions of someone looking for a hero narrative, but the questions of someone who understood that the real story was the 11 reports, the institutional suppression, the way a single person's persistent documentation had become, inadvertently, the evidentiary backbone of a multi-facility investigation. She understood that the human interest was not former military hero wrongly accused, but something more uncomfortable and more durable. What happens when an institution decides that the person telling the truth is more inconvenient than the problem they're describing? "One question off the record," Finch said, near the end. "Ask." "When you went back," Finch said, "when Reyes called you and you'd already left the parking lot, you went back for the dog. But you also went back into a building where you'd just been suspended and publicly accused. Why?" Emily was quiet for a moment. "Because Ranger needed care and I was the right person to provide it," she said. "And because leaving would have been the wrong decision, and I knew it was the wrong decision. And I've made enough correct decisions under pressure that I've learned to trust that knowledge when I have it." "Were you angry?" "Yes." "But you went back anyway." "Being angry doesn't change what needs doing," Emily said. "It just means you do it angry." Finch was quiet on her end. Then she said, "Thank you, on record and off." "Run the story correctly," Emily said. "That's the thank you I want." The story ran at 11 p.m. online and in the print edition the following morning. Dara Finch ran it correctly. The headline was straightforward. Local nurse cleared of false accusations. Investigation expands to regional hospital network. And the framing was the framing Emily had asked for. Institutional failure, documentation, the specific mechanism by which a single administrator's decision to suppress safety reports had compounded across 14 months into something that had reached, potentially, as far as a death in Grenville that a family had spent 18 months believing was someone's individual mistake. The photograph ran. It was placed not at the top of the article, but 2/3 down, beside the section about Meridian Cross, and it was exactly what Briggs had described. Emily coming out of the field hospital tent, leg dragging, Ranger across her arms, eyes forward toward the landing zone, looking like someone who had already done the math on the distance and found it manageable. She looked exhausted and certain simultaneously, which was an accurate portrait of how she had felt, though she hadn't known anyone was capturing it. The caption read, "Emily Voss, then serving with a forward medical unit in an overseas humanitarian mission, carrying military working dog K97 during an emergency extraction." 6 years later, Voss would stabilize the same animal after a training injury at Hargrove Memorial. It was accurate. It contained no superlatives. It did not call her a hero. She appreciated that more than she would have appreciated the superlatives. The Regional Wire picked it up before 6 a.m. By 8, the story had been shared across 3 states, and the Dunmore Courier's website had traffic it had not previously experienced in its operating history. By 9, the State Healthcare Administration had issued a press statement confirming the expanded audit scope and naming Hargrove Memorial as the origin facility of the investigation. By 9:45, the Grenville case was being publicly discussed in connection with the audit for the first time, carefully and with appropriate legal framing, but discussed. The question of whether the nursing aide's death had occurred in a context of suppressed safety reporting was now a matter of public record rather than a family's private suspicion. Emily heard about each of these developments secondhand, in pieces, while she was on shift. She learned about the wire pickup from Pell, who came to find her in Bay 2 with his phone showing the shared article count, and the expression of someone who was not sure what the correct reaction to this information was. She thanked him and went back to the IV she'd been managing. She learned about the state press statement from Renata, who relayed it with the concise efficiency of someone delivering a shift update. She learned about Grenville from Reyes, who called at 10:15 while she was on a break. "The family has been contacted," Reyes said, "by Marcia's office. They've been told the audit will include a full review of the safety reporting record at Clearwater during Fitch's tenure." He paused. They asked who brought it to light. What did Marcia's office tell them? That there was a nurse in Dunmore who had been filing reports for 11 months, Reyes said, and that the documentation she created was what gave the audit its framework. Emily sat with that. She thought about a family that had been given an explanation for 18 months. Individual error, human mistake, the kind of isolated failure that institutions use to close a loop without examining what the loop was attached to. She thought about what it meant to be told, after 18 months, that the loop was not closed, that the question was still open, that someone had been keeping records. It was not justice. Justice was what happened in a courtroom, if and when the process worked the way it was supposed to. This was something earlier and smaller, and in some ways more important, acknowledgement that the question was worth asking. "Tell Marsh to make sure they have someone to talk to," Emily said. "Not just the formal notification, a person, someone who will answer their questions." "I'll tell her," Reyes said. Bob. Gerald Fitch was discharged from Ridgemont Medical's cardiac ICU on Thursday morning, 4 days after his collapse in the second-floor corridor. I was discharged into a situation that had continued to develop in his absence. The DA's office had received Marcia's referral and assigned it to a senior prosecutor. The independent audit had identified 37 discrete instances of suppressed safety documentation across Fitch's combined tenure at Hargrove Memorial and Clearwater Community Hospital. Of those 37, 9 had involved maintenance deferrals on critical equipment, 4 had involved medication system failures, and 1, the one in Grenville, was now under a separate sub-investigation for potential criminal negligence. Fitch's attorney issued a statement saying his client would cooperate fully with all relevant investigations. The statement also noted that his client had experienced a serious medical event and asked for privacy during his recovery. The board of Hargrove Memorial issued its own statement the same day, which was substantively different from Fitch's. It named the specific policy failures that had occurred under his administration, committed to the implementation of the new escalation protocols that Kern had described to Emily, and announced that all 7 affected departments would have their records corrected with formal letters of notation placed in the files of any staff member whose professional record had been adversely affected by the phantom transaction errors. Emily's name was in that statement, not prominently. She was listed as one of several staff members whose records were being corrected. But she was in it, in a document with the hospital's official letterhead and Kern's signature, which meant it was permanent and institutional and part of the record in a way that her 11 email reports had not been able to be. She read it on her phone during a break, standing in the locker room, and she felt something she hadn't fully expected to feel, which was tired. Not the bad kind of tired, not the exhaustion of someone who had been worn down, but the specific tiredness of a person who has been holding a very heavy thing for a very long time and has finally set it down and is feeling, for the first time, the full weight of what it was. She sat on the bench in the locker room for 4 minutes. She let herself be tired. Then she stood up and went back to work. The formal board commendation ceremony was held 10 days later in the hospital's main conference room, which fit about 60 people at capacity and had 83 in it on that Thursday afternoon. Emily had not asked for the ceremony. Kern had told her it was happening, and she had said, "Is it necessary?" And he had said, "For the institution, yes." And she had accepted that because he was right. Institutions needed ceremonies the way people needed rituals, as a way of making change legible to everyone who had to live inside it. She wore her regular scrubs because she was working a full shift that day, and the ceremony was scheduled during her lunch break, which she'd always found to be the most honest scheduling option. No special outfit, no staging, just the person she was. In the context she worked in, being formally acknowledged in front of people who had watched her be formally accused in the same building 10 days earlier. The room had Kern at the front. It had Reyes in dress uniform, which she hadn't anticipated, and which surprised her more than she showed. It had Investigator Marsh standing to the side with the contained attention of someone attending in an official capacity. It had Renata Diaz, who had apparently told her entire team to show up, which accounted for at least a third of the room. It had Specialist Diekman and Sergeant Price from the 114th in uniform, standing at the back. It had Warren Tillis, who had been discharged 4 days ago and had apparently decided that attending was worth the drive back to Dunmore, and who sat beside his wife in the third row with his ribs still taped and his expression communicating that he intended to be here regardless of what his cardiothoracic surgeon had recommended about minimizing activity. It had Marcus Briggs near the back, leaning against the wall with his arms crossed, watching the room with the particular observation of a man who has spent a long time paying attention in spaces where attention matters. And it had, on a low transport cart in the corner, Ranger, cleared by Farrow for limited mobility, who had apparently been brought in by Diekman at Reyes's request, and who lay on a blanket on the cart with the peaceful dignity of an animal who had been in enough significant situations to be comfortable with whatever this was. Kern spoke for 6 minutes. He covered the administrative failures factually and without euphemism, which Emily appreciated because it would have been easy and technically sufficient to speak only of the positive outcome and leave the mechanism vague. He named the suppression pattern. He named the 11 reports. He named the specific decision Fitch had made that had redirected the investigation, and he acknowledged directly and publicly that the hospital had failed in its duty to Emily Voss and to its broader patient safety obligations. He did not say he was sorry in the performed way. He said it in the way that people in his position rarely managed, which was through specificity, naming the exact failure, taking institutional ownership of it, describing exactly what was changing. That was the form apology took that actually meant something. Then Reyes stepped forward and spoke for 4 minutes about Operation Meridian Cross, which he had received clearance to discuss in general terms, and about the field medical record, and about a commendation that had been classified for operational reasons and had therefore lived in a file for 6 years without anyone who worked with Emily knowing it existed. The designation Iron Grace, Reyes said, was assigned by the field commander based on 4 months of documented performance in a forward medical unit. It was not a nickname. It was a formal designation in the unit record. He paused. It referred specifically to the quality of continuing to work under conditions that would justify stopping, of finding the functional within the impossible. He looked at Emily. Voss did not stop. In a field hospital, in a corridor in this building, at a medication cabinet with her hands shaking from nerve damage that has nothing to do with guilt and everything to do with not having quit when quitting was an option. The room was very quiet. Emily stood at the front of it and looked at the 83 people who had come, and she felt the complicated weight of being seen, not the way she'd been seen on the morning of Holt's arrival, which was the wrong scene, the scene that turns a person into a problem to be managed, but the scene that asked nothing from her except presence. The scene that said, you were here and you were real, and that mattered. It was harder to receive than accusation, which surprised her. Kern presented the commendation, a formal document in a folder, the kind of thing that would sit in her professional record for the rest of her career, and she took it with both hands and said, thank you, without elaboration, because elaboration would have been wrong. Then Kern asked if she wanted to say anything. She had not prepared something. She had considered preparing something and decided against it, because prepared remarks at this kind of event had a quality of performance that she wasn't willing to produce. What she said was therefore imperfect and incomplete, and exactly what she was actually thinking. I want to say something about the 11 reports, she said, because that's the part of this that matters most to me. She looked at the room. Every report I filed was a decision to commit an uncomfortable fact to the record rather than decide it was someone else's problem. That's not heroism. It's the minimum. It's what documentation is for. She paused. The system failed to act on the documentation, which is the institutional failure that Kern has described. And that failure has consequences that are still being worked out in Grenville and in the audit and in a prosecutor's office somewhere. She stopped. But the documentation existed. It could be subpoenaed. It could be cross-referenced. It could form the framework for an investigation, because someone wrote it down. She looked at the nurses in the room, Renata, Pell, Chandra, the others she'd worked alongside for 4 years. Write things down, she said. File the report, send the email, create the record. Not because the system always works. It doesn't, as we now know from documented experience, but because the record is the only thing that survives institutional pressure intact. Your name on a timestamp is a form of resistance that has no expiration date. The room was quiet for a moment after she stopped. Warren Tillis started clapping first, which was slightly awkward because of his taped ribs, but he did it anyway with the determination of a man who had decided that discomfort was not a sufficient reason to not do the correct thing, which was, Emily thought, a lesson she had apparently taught him without meaning to. The rest of the room followed. She looked at Ranger in the corner. He had his chin on his blanket and his ears forward and his eyes on her, which was where they had been, on and off, for the past 10 days. She looked back at the room. She stood there and let it happen, which was its own kind of hard work. The work of receiving what you'd earned without minimizing it or deflecting it or deciding it was too uncomfortable to accept. She had spent a long time being the person who didn't take up space, who filed reports quietly and clocked in early and walked the long way from the parking lot and never explained the brace to people who asked about it with their eyes. She had done that because it was what the circumstances required, and because she was genuinely not someone who needed to be the center of attention to feel real. But this was different from needing the attention. This was allowing the truth to be acknowledged, which was not about her ego. It was about accuracy. The accurate record. The one that said she had been here, had done this work, had filed these reports, had carried this dog across 40 meters of cleared ground with a fragment in her leg, and none of it had been adequately acknowledged until today. The record was accurate now. That was enough. 3 weeks later, Hargrove Memorial opened what it was officially calling the Veterans and First Responder Recovery Liaison Program, which was a deliberately administrative name for something that was more personal in practice, a coordination office between the hospital's clinical departments and the 114th's Rehabilitation Initiative, designed to streamline care for veterans, active personnel, first responders, and, at Reyes's insistence, and with Farrow's enthusiastic endorsement, retired military working dogs. Emily took the role Reyes had offered her, part-time, concurrent with her regular nursing position, because she had been right that she liked her job and the patients were real and the work was concrete, and she was not going to leave it to become an administrator in a carpeted office. What she agreed to was the protocol design work, the clinical frameworks for how the liaison program would interface with trauma care, how patient histories with service-related injuries would be documented and communicated, how the specific knowledge gaps between military field medicine and civilian hospital systems would be identified and bridged. It was, in practice, a translation project. She was fluent in both languages and had spent 4 years being frustrated that no one was using that fluency systematically. Now someone was. Her first meeting with the liaison program team was in the conference room 2 floors above the main ER, on a Tuesday morning, 3 weeks and 2 days after the Tuesday morning that had started with Holt and a folder and the particular loudness of a public accusation. She sat at the table with Reyes and Farrow and a veterans advocacy coordinator named Bet Solano and a first responder wellness consultant named Ike Darden, and they spent 2 hours arguing productively about intake assessment protocols and clinical handoff documentation, and the specific question of whether emotional support animal designations for retired MWDs should be processed through the veterinary channel or the patient care channel, which was a more complicated jurisdictional question than it sounded. She left the meeting with 4 action items and a headache from the intensity of the argument, and she went directly downstairs to check on her afternoon patients, and the day continued. The DA's office filed formal charges against Gerald Fitch 8 weeks after his cardiac discharge. The charges covered 11 counts of deliberate suppression of required safety documentation, 3 counts of filing false administrative certifications with the state healthcare oversight body, and 1 count of obstruction related to the Clearwater incident, not a charge of direct causation for the nursing aide's death, because the causal chain was not clean enough for that charge to hold, but obstruction of the subsequent investigation in a way that had prevented the family from receiving accurate information. His attorney entered a not guilty plea. The process began, which meant it would take time. The correct amount of time, the amount Emily had asked for when she'd spoken to Kern in the corridor. A proper accounting rather than a fast one. Sandra Veen was not charged. She had acted in good faith on information she'd been given, and she had cooperated fully. and the investigation had determined that her culpability was institutional rather than personal, a failure of the system she'd been embedded in rather than a failure of character. She applied for a position at a different regional hospital and included a reference letter from investigator Marsh, who had seen her handle a difficult situation with integrity once she had the full picture. Foster Grun did not resign. He implemented the external IT audit he'd recommended, oversaw the system-wide diagnostic that finally identified and patched the duplication error in the dispensing software, and spent 6 weeks writing a new vendor assessment protocol that would require condition-specific testing rather than surface diagnostics for all future software certifications. He sent Emily a copy of the protocol with a one-line note that said, "Report number 3 is cited in section 4, footnote 2. It should have been cited in the implementation, not the retrospective. I know that. She filed it in her records." Deputy Holt participated in developing new county sheriff's office protocols for medical workplace investigations, a process that required him to sit in a room with clinical staff and patient advocates and learn, methodically and with visible discomfort, how many ways a symptom could be misread by an observer who was already looking for evidence of guilt. The protocols took 4 months to finalize. He was listed as a contributing author. It was not a comfortable process for him, and the fact that he did it anyway was the thing that most closely approximated the distinction Emily had tried to draw in the nurse's station on that Wednesday morning when she'd told him not to waste it. He did not waste it. The photograph ran in the regional wire and was picked up by 2 national outlets before the week was out. Emily did not look at it online. She knew what it looked like. Briggs had described it, and she had made her statement, and the caption was accurate, and that was the version of it she had chosen to authorize with her own words. Whatever anyone else decided to make of it was outside her control, and she had spent enough energy on things outside her control in the past 2 months to know when to stop expending it. What she received over the weeks that followed was correspondence, not a flood. She was not famous, and Dunmore was not large, and the story had the particular half-life of regional news that is significant locally and notable briefly elsewhere before the cycle moved on. But some. A letter from a nurse in a hospital in another state who had been filing safety reports for 7 months and had been told, twice, that the system had been reviewed and cleared. A message from a veteran who had cycled through 4 civilian hospitals in 2 years and been unable to communicate his service-related medical history in a way that the clinical staff understood how to use. A note from a family in Grenville that contained no request and no accusation, just 3 sentences saying that they had read the article and they were glad someone had kept the records and they were waiting to see what the investigation produced. She read the letters and she responded to the ones that had addresses, and she filed the rest in a folder she kept in her desk, not because she knew what to do with them yet, but because they were documents, and she had a settled habit of keeping documents. On the last Tuesday of April, which was 6 weeks and 2 days after the Tuesday that had started all of it, Emily Voss clocked in at Hargrove Memorial at 5:47 a.m., 13 minutes early, the way she always did, and she walked from the far parking lot with her brace clicking against the cold, damp asphalt of a Colorado morning that had not yet decided whether it was spring yet, and she pushed through the ER doors into the antiseptic warmth of the hospital, and she went to the nurse's station and picked up the shift briefing. Renata was at the station. She handed over the briefing with the economical efficiency of a charge nurse at the start of a shift. Bay 2 has a post-surgical overnight who needs pain management reassessment, Renata said. Bay 4 had a difficult access case at 4 a.m. that Pell handled. He went slightly medial on the forearm, found the vein in under a minute. She looked at Emily over the counter. "He told me you taught him that." 40 seconds, Emily said. He said under a minute. It was 40 seconds, but close enough. She picked up the briefing. "Anything else?" "Reyes called," Renata said. "He said Ranger passed his 30-day post-injury assessment this morning. Full clearance. He's going back to active light duty." Emily looked at the briefing in her hands. "Good," she said. "He also said," Renata continued with the careful neutrality of someone delivering a message exactly as received, that Ranger made Diekman do 3 laps of the assessment room before he was willing to do any of the testing, and that he stopped at the door and looked at the handler and then looked at the camera in the corner of the room for about 15 seconds. Emily said nothing. "Reyes said he doesn't know what Ranger was looking at in the camera," Renata said, "but he thought you'd want to know." Emily looked at the medication cabinet across the hallway. The same cabinet, the same digital lock, The same dispensing log that now ran clean, the duplication error patched, the phantom entries purged, the record corrected back through 8 months of misattributed transactions to the point where the data was simply true again, the way data was supposed to be. She thought about what Briggs had said in the parking lot, that the field was still there, and how she moved and how she thought. She had said it was a long time ago. He had said maybe it was just a different field now. She thought he'd been right, which she hadn't been willing to say at the time. The field was here. It was always here. It was the difference between the patient who got the vein in 40 seconds and the patient who waited 4 minutes. It was the report that got filed on a Tuesday and subpoenaed on a Wednesday. It was the hand that went to the crash cart without calculating whether the person in cardiac arrest deserved the effort. It was the decision, made 10,000 times in a career, to do the right thing in the absence of any guarantee that the right thing would be recognized or rewarded or even noticed. It mostly wasn't noticed. That was the thing nobody said clearly enough, Emily thought, not in the stories that ran on regional wires or in the commendation ceremonies or in the conversations where people asked, with genuine curiosity, what it had been like. The truth was that most of the work was invisible. Most of the correct decisions left no photograph. Most of the reports filed in good conscience went into inboxes where they sat without response. And most of the times that you chose the harder thing over the easier thing, you chose it alone in a hallway or a parking lot or a field hospital tent, and no one was watching, and it didn't produce a ceremony. You did it anyway. Not because you were exceptional, not because you were built differently from other people or had access to some reserve of will that ordinary people lacked. You did it because you'd made a decision, somewhere early and foundational, about what kind of person you were going to be when the situation was hard and the outcome was uncertain and the people in authority were looking the other way. That decision was the whole of it. Emily Voss clipped her badge to her scrub top, the photo 2 years old, the name accurate, the clearance status restored and documented. And she picked up the shift briefing, and she walked to Bay 2 to check on the post-surgical patient who needed pain management reassessment. And she did it with her left leg dragging slightly in the morning cold, and her hands steady and her eyes forward, the way she'd always moved, the way she intended to keep moving. Not toward a camera, not toward recognition, just toward the next thing that needed doing. That had always been enough. That was always going to be enough.